in our men's core treatment program, we often see men who say, I don't really want to be here, but my mate, my children, my whomever said I had to change. So there's external motivation, and we're okay with external motivation for a while until the motivation becomes internal. Welcome back to another episode of Mad in Love. I'm your host, Dr. David Hoffman, and this is our favorite segment of the podcast, which is Dr. Hawkins Reacts, where my colleague Jonathan Glover and I react to Reddit posts.
This is by someone named Yvonne, written 5 months ago. I think this only would work with someone with narcissistic tendencies, not a real narcissist. People get them confused. A real narcissist can never see their own faults or make change. My father is a covert narc, has lost everything and had everyone try to help him. He had a couple strokes and heart attacks, can't take care of himself, and no one wants to help him, although his sister does. He still has a grandiose dreams about his future and thinks that he's a perfect saint. Nothing will ever break him. I think he will die smiling in his delusional fantasy land.
My goodness, we hear this all the time, that narcissists can't be treated. And I presume when she uses the word narcissist, she's talking about what we call a spectrum. Narcissistic traits on one end of the spectrum and narcissistic personality disorder on the other end of the spectrum. We see folks all the time where, she uses the quote, nothing will ever break him. And that may be true, and it actually may not be true. So I happen to love the phrase, the breakdown that leads to the breakthrough. And typically when we're threatened with losing something very important to us, most of the time, most of the folks that we see, they can be broken, actually. There can be a crack in their character armor, but it takes something. It often takes a separation. It takes maybe even a family. We're doing more work with adult children who are saying to this narcissistic parent, we're not, much like an alcoholic or drug addiction or whatever, some other kind of addiction, we're not going to tolerate this behavior, these attitudes anymore. And then we see the fracture in him or her, and there can be an opening. So I don't know that I very often see the phrase nothing will ever break them or him or her, but often there can be a structured intervention, and we've done podcasts on intervention. We've done a lot of writing on the topic, but so I don't know. I certainly, if we tolerate that kind of bad narcissistic behavior, it will continue. And if we don't tolerate it, then there could, not always, but there could be an opening for change. Jonathan, thoughts?
Yeah, throughout the, 19, 20 years that I've been doing therapy, I've worked with a lot of individuals with diagnosed personality disorders, including NPD, BPD, and I think it is developmental, like we were talking about before. It is very difficult to change because there is a lot of work that is involved, but I wouldn't be doing this work if I didn't believe that people could change, because I've seen it.
Okay, so just to follow up then.
Yeah, and
yeah. Sorry, Dr. Hawkins.
Go ahead.
I guess my follow-up question is, we have a lot of material out there talking about how we help individuals with narcissistic tendencies, and we've been very clear about working with people with the tendencies of emotional abuse and narcissism. Are you saying that, I'm kind of speaking to Jonathan right now, are you saying that even people who have been clinically diagnosed NPD, there is still room for change?
Yes, I would say so. I would also say that change is difficult, and it takes time. It takes a consistent effort over time, which is also really difficult. I think there's one question of whether or not the narcissist can change. There's another question of whether or not the victim or the partner of the narcissist wants to remain in that relationship with that individual, who will have the potential of causing future harm. I'm similar to an alcoholic or other types of addiction. That is a decision that the partner would need to ask themselves very, very carefully, because there's
But
always going to be that struggle in that area. And honestly, I think that the narcissist or somebody with borderline personality disorder or any other type of personality disorders need to they need to think about work in that area as ongoing for the rest of their life. They always are going to have to be thinking about it and working on that and trying to progress and advance in that developmental area. But it's not just okay, I'm going to do a 8-week program, or I'm going to do a 2-month, 3-month program. It's much more than that.
And would you say this? Here's what I bring to the table on this topic, and it's uncomfortable. I want to bring up the word intervention again, or internal versus external motivation. And so, I'm going to tell you a quick story. Many years ago, I was the psychologist on a drug and alcohol inpatient treatment program. Yeah, I did that for at least 2 years. I can only remember, out of the hundreds of people that came in, I can only remember one that came in and said, I'm here because I want to be here. Let's say that there were 200, 199 of them. Why are you here? Oh, I got my third DUI. Oh, my employer said I had to get treatment, or my spouse said they were going to leave me if. Oh, so you're not really here because you want. No, I don't want to be here. Are you kidding me? I don't want to be here. Did we take them in? We did. Did we work with them intensively? We did. Would I much prefer the one who came in and said, I want to be here because I want to change? All right, what's the point? In our men's core treatment program, we often see men who say, I don't really want to be here, but my mate, my children, my whomever said I had to change. So there's external motivation, and we're okay with external motivation for a while until the motivation becomes internal. So anyway, back to the change process. The intervention has to have been done, and it needs to keep being done. And that's an uncomfortable thing to ask a victim of emotional abuse to do. Are you willing to, one degree or another, hold him accountable for continuing in our initial core treatment, for our dual core treatment program, and then our advanced core treatment program, and then our core strength treatment program, treatment groups? So it is a process of holding this individual accountable, not just sitting back saying, I hope he will change. So I think intervention and accountability have to be part of the treatment process.
I'm curious, Dr. Hawkins, about what you said about the inpatient program, and then also I'm kind of reflecting on some of the men in our groups, our programs. How many of them come in perhaps in that pre-contemplation? I don't want to be here. I don't think this is a problem. I don't think this is real. And then at some point throughout the course of the 14 weeks, or if it's an inpatient program, the 30 days or the 45 days, at some point there is also a percentage of people who move from that pre-contemplation stage into the planning, preparation, or even that action phase. And by the end of that period of time, say, actually, yeah, I came in here not wanting to be here, and reflecting now, I think this is exactly the place that I needed to be. And so I'm just curious about your thoughts on that.
we see lots of men get there, and that always surprises the treating community out there. Like they're going like, I don't know, narcissists can't be treated. No, no, there's no. We see hope. We see the possibility of change. So, I mean, is your question? So you seem, Jonathan, to be talking about the notion of gradual ownership. Gradual ownership, moving from external motivation, or what you've called pre-contemplation, to
The stages of change.
contemplation. Yeah, to saying, sure, after at week 8, 10, 12 in our initial core group, you hear men say, well, maybe, maybe, maybe I really do have some narcissistic traits. Maybe, gosh, I guess the way you talk about, I mean, I guess I'm a little bit similar to John. I'm not as bad as John. I'm not as bad as uh, Harry, but yeah, maybe, maybe. And then we see the maybe move into, I think I am. And so if we can keep that motivation going, and, it feels good to grow. That's we see men who go like, man, I hated the group at first, then I only disliked the group, and then I just kind of a little bit disliked the group, and then my goodness, I think I like the group.
And then I was
And
sad it was
anyway,
ending.
so and then I was sad it was ending. And the clinical community out there, by and large, are looking at us going, I don't know, I'm not so sure, but we see it all the time.
And don't misunderstand. If anybody listening to this, don't misunderstand. There are absolutely guys who go into the group resenting being there and hating being there, and then they end the group and they just are full of even more resentment and even more anger. And that is, it's really, it's sad and frustrating to see that as a response. But
that's a small percentage.
I was just about to say that. I would actually say that that's a relatively small percentage. And what gives me energy to do this work is not necessarily the guy that comes into the group excited to be there. Those guys are great too. I like working with them. But the people who are moving through those phases of change and ownership, that's really pretty exciting to see.
Please, everyone, take note of what Jonathan just said. There are phases or stages of ownership and growth. It isn't one and done. It isn't, come into the group and you'll own everything and you'll change and life. But no, it's it's 2 forward, 1 back, 2 forward, 2 back, 2 forward, 1 back, and 2 forward. Anyway, and the slope of change is growth. It's what we see by and large. Are there exceptions? Of course, but generally speaking, if we can keep that motivation going, if we can keep the accountability going. By the way, we want to reassure her, your voice is very, very, very important to us, very important to the treatment process. We're not going to look at you to say you've got to hold him accountable, but we're listening to you. We want to hear, is change really happening?
I want to validate all of this too, to those who are listening and watching. They are the clinicians. They are on the forefront of all of this. But I work on the admin side and I get a lot of calls. So I've talked to a lot of people in the back end, and we do see a lot of that. We see a lot of resistance from the beginning, calling in the initial call. And later on, months down the line, we're getting these emails saying, when's the next group? What's the next step? And it sounds outrageous because you would never think at the beginning they would have anything to do with our treatments.
Yep. Long, slow process, but if we work together as a team, change really can happen, and we're seeing it. But it's got to be the right kind of treatment. It's got to, as Jonathan was saying, it's got to be treatment for attitudes and beliefs and behavior, and we've got to look at it comprehensively, and we do. All right. Well, fantastic. Listeners, if any of this resonates with you, you can always start by visiting our website, www.marriagerecoverycenter.com to book a free 20-minute phone consultation with one of our very well-trained client care specialists to learn how to get started on getting help. And if you've enjoyed this episode, please take a moment and leave us a 5-star review and subscribe to our channel to be notified of upcoming episodes. Until next time, this is Dr. David Hawkins and Jonathan Glover signing off for Mad in Love. Take care. God bless.